technical things of acupuncture will be on the revision course. There will be many parts of revision course. Those who want to get expertise in group A, group B, group C. Every month there will be a course. Every Sunday there will be a revision course. Revision course means we will re-interact and we'll talk with many procedures about various things, right? Our class will begin for only 1.5 hours. I don't have much time. My health is also not good. I permit you to give me this time to revive. I'm even taking class after seeing more than 110 patients. Yesterday my OPD was 120. So I hope you understand my health conditions also. You will cooperate. I pray to God for your success. Right?
And so can I just clarify that class is 7 or 8 p.m.?
8.
Okay.
I reduced 1 hour because my health is not good. I hope you will forgive me for that. Because the workload is very high, no one is helped to it. There are only two physiotherapists.
Enggak, cute. Kita pa sila lahat.
Everyone in all the rings. Recording of the classes be given to others, right? So see, there are many equipment combination. These are the slides from Nanjing University. These are standard international slides. You can read it about it various places, various place, and right now I'm working as a director of the Institute of Neurosciences. Very soon we'll have a fellowship. We'll integrate with international universities. These fellowship courses will be transferred to MSc course after the examination of the university. So those who are serious, they can convert their degree to MSc course internationally, collaborated with 3 universities, India, Malaysia, and one more country. Pay their fees and take it. At least it will help you to work in different countries. Next. See, the point prescription method is based on the characteristics of the point indications and principles of point selection. देखिए एक बात आपको समझना होगा. I'll speak in both English and Hindi, right? From now onwards, earlier we speak in Indonesian भाषा. From now onwards, I'll speak in English and Hindi. देखिए points जो होते हैं acupuncture points, they are nerve endings, यानी nerve की ending होती है. When we puncture them, a stimulus goes to the brain, यानी एक stimulation brain तक जाता है. इसको हम लोग पाथवे बोलते हैं. एक गिलास और डालना होगा, बड़ा वाला ग्लास लगे थे तो एक बोतल मिला के देखो, वो डिहाइड्रेशन है. वो जीरा पानी नहीं है, जीरा पानी वो चाट मसाला डाल के दे दो, एक बोतल में दे दो. हाँ, तो मोड़ी भी बना दे रहा, बेल मोड़ी. In clinical practice, single points are used for emergencies, simple specific symptoms, but on my occasion point combinations are used. See, one thing you must very much understand. Acupuncture is not point. यानी acupuncture point नहीं है. It is a methodology to revive your body to fight against the disease. There are two ways of fighting against the disease. बीमारी से फाइट करने के दो रास्ते हैं. या तो शरीर उससे फाइट करे या दवाएं उससे फाइट करे. Acupuncture is a system which helps you to fight with the disease. Acupuncture वो सिस्टम है जो बीमारी से फाइट करने में आपकी मदद करता है. How? By improving your immunity power, by improving your energy levels, and it helps. But इसका मतलब कहीं भी ये नहीं लिखा हुआ कि we should not take allopathic medicines or homeopathic medicines. Rather, it is very good if you take. You can take allopathy, you can take homeopathy, you can take all medicines in combination with acupuncture, and it acts as adjuvant to the person. When in our clinic, we work with the same way. We believe that God helps in the same manner. I hope things will go on, carry on, and will improve in the way you all have thought. Acupoints vary in general cases and categories as point combinations according to locations or meridians. Now see selection. Acupuncture is both science and art. Acupuncture science भी है. A person having same osteoarthritis, you have 7 patients, but in all the 7 patients, the points are different. So the now what is a general practice? आज का practice क्या है? You are giving us an MRI report and you are saying please prescribe the points. Do you know how foolish we are? आपको मालूम है हम लोग कितना बड़ा गलत काम कर रहे हैं. ये सवाल पूछना भी गलत है. This is a wrong question you are asking. Why? Because on the basis of MRI report, if you ask, what will happen? You do not know the physical condition of the body and you prescribe the points. It's the most wrong condition you are doing. And now if you combine with acupuncture with NIBS, you combine tongue with brain stimulation. There was a patient, today I'll tell you, we used Sastri 1. It's not over here. You can see my finger? Just come down. From the center, it goes little here. Can you see? From center, other ear and here. From center, it goes little here. We injected a needle here and we punctured 2 needles here. What happened? The patient was carried tumor on the ventricle, fourth ventricle tumor. He was unable to walk, and after 7 days of treatment, is walking on the treadmill. Tomorrow's videos will be uploaded. You can see. He is a patient of fourth ventricle tumor. Now, what do you want? Recovery of the patient or no recovery of the patient? It depends up to you. The best part of your life is to integrate this knowledge so that it helps the people. Integration of knowledge is most important part, and you must learn and practice that very system which recovers the patient, not satisfies the patient. Why do you do so much pampering to the patient? As if he's your as a slave of the patient. Many doctors I see, they pamper the patient, but they still have 120 patients. Why? I single-handedly treated, and they are all complicated cases. And on the table, I recovered them. So you must understand, if you practice properly in a nice way, you will get good results. I'm sorry I'm little dehydrated because I did not get time to eat my food today. So sometimes if I close my eyes, just wake me up, okay? Vinny, or anyone, please wake me up. Sometimes I'm asleep. I'm little tired. Okay. Can you hear me? Are you
Yes,
hearing
sir.
me?
Yes,
Yes,
sir.
sir.
Well,
Yes,
sir.
Chandri, bhai,
on this microphone, but we
Kanyan,
can
for
hear you.
2 or 3 minutes, understand I have slept. Wake me up, okay? Satriji, please get up. You are in the
Okay.
class.
Okay, sir.
I'm
Sir,
exhausted
I
because
think your mic
you
is
imagine if you see
fine.
100 patients, if you see 100 critical cases, can you hear me now?
Yes,
Yes,
sir.
this is better, sir.
Now better?
Yes,
Better or
this is
not
louder, sir.
better?
Yes, yes,
Or you
yes.
buy me a good mic and give me? I don't know what to buy. You buy me a good mic and give me. If this is not better, then.
So yeah, okay, very clear, loud and clear. I think
So
it's
see,
a
acupoint.
local problem.
Huh? Any?
It
You
is
are far
What
their,
is
from
the
the
problem?
microphone, sir.
yeah, your mic is very good and clear, loud and clear.
Any
So I think
problem? They
it's
said
their
to
local
Mini.
problem.
No, your voice is okay, sir.
Yeah, very loud and clear. No problem.
What should I do now?
No, you're good. No problem.
Nothing. It's the participants' problem at their side, I think.
Carry on, sir.
Not my from my side. So can I
Yes,
carry on? By chance, if I
sure.
sleep in the
You
classroom,
can
please
carry
wake
on,
me up.
sir. You just need to
Okay.
be a bit closer to the microphone.
Loud and clear, sir. You can carry on.
See, acupuncture was a system which was developed with a close meditative style. Usually, these Jain monks and all, they used to go in a deep meditative style and used to find out locations which could directly interfere with the brain functioning, right? On the basis of that, they analyzed that internal malfunctioning of the body makes a disease. But our medical system does not believe it. They believe that blood parameters, NCV, EV, EMG, and all. So it is a time where we should integrate both of the things. Old science, because new science cannot recover the patient. I have seen a demyelinating neuropathy patient has been much better than he was. Now what we need is a EMG machine and EMC, NCV machine, right? What we need is a EMG and a NCV machine. And you will have to know it will be one of the best neuroscience of this country. So now the combination of the point has to be said. See, the first thing is many people can recover with single point. Now you can see there are many schools of acupuncture, classical school, modern school. Now when we speak about classical school, this was the school which used to work with 3,500 points. Can you hear me?
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir. Yes,
So
sir.
this school worked with more than 3,500 points, but it was not easy for you to classify things. When the American president went to US, he found that this acupuncture was very useful, and then he allowed this acupuncture to be used in his body, and his frozen shoulder was recovered in 1 minute, while in US they could not do. He found it so wonderful that he introduced acupuncture in US. But later on, then it was introduced, but then the history goes on in US and other countries, basically in US, that people did not, we always know there's some interference and jealousy with other system of treatment, because this system of treatment does not prescribe medicines. This system of treatment does not prescribe medicines. And a medical doctor who passes out for 4 years or 5 years, He said, I have passed out for 5 years, and how can he be superseded? So certain legal and clinical problem comes. Certain problems came in America with Mariam Lee. She was a teacher of two. My speed is okay, or am I speaking fast?
It's okay, sir.
Okay, sir.
Okay,
It's
sir.
तो मैं
okay,
अभी
sir.
मैं इसको हिंदी में बताता हूँ। अमेरिका और बाकी
सर
कंट्रीज में
कैमरा थोड़ा एडजस्ट कीजिए ना, आपका चेहरा पूरा नहीं दिखाई दे रहा है।
अच्छा
अब बस
अमेरिका
ठीक है फाइन।
एक्यूपंक्चर आज से 5,000 साल 10,000 साल 15,000 साल पुरानी साइंस है। ऋषि मुनि ने कड़ी तपस्या करके इन चीजों को समझा। क्लासिकली अगर हमारे वेदों में पढ़ा जाए, ऋग्वेद में यथा सर्वम सर्वभूतानाम भविष्याणाम भविष्यते, यानी आपका भूत भविष्य वर्तमान आपके अंदर है, यानी द वे यू लिव इज योर लाइफ। आप जैसे जीते वैसा शरीर बन जाता है। खान पान यानी फूड हैबिट्स makes you. Earlier we never used to believe the food, now enteric nervous system makes you believe, यानी आंतों का जो सिस्टम है वो आज इस बात को साबित करता है कि हमारा खान पान से बीमारी का उत्पन्न होता है। Now if you say where is Parkinson's created, Parkinson is not created totally in brain, it is created in ENS यानी the gut system, यानी हमारे जो आते हैं जिसमें गट सिस्टम है उसमें पार्किंसंस क्रिएट होता है। बट वो कैसे क्रिएट होता है उस बात को समझने के लिए आज हमें और अध्ययन की जरूरत है। 5,000 साल पुरानी बातों को समझने के लिए हमें आज बहुत गहराई में उतरना होगा। अब एक छोटी सी बात समझिए, मेरे पास न्यूरोसर्जन्स आते हैं। आज सबसे पहली बात, फर्स्ट टाइम यू लव टू नो, द न्यूरोसर्जन सेड आई वांट टू लर्न सिस्टम, I cannot recover these patients. They are amazed to see every day a new doctor comes to me. Medical surgeon, neurosurgeons, MDs, right? And then they see the patients. And they are the one who refers patients here. They refer their relatives. They refer their
Relatives.
relatives. Can you hear me?
Yes, sir.
प्रकाश जी आवाज आ रही है?
यस सर, आवाज आ रही है लेकिन कट रही है। मतलब नेट का कोई स्लो नेट हो सकता है वहाँ का।
उसका तो मैं कुछ नहीं कर सकता भाई।
सर मोबाइल और लैपटॉप इकट्ठा तो नहीं
ठीक है
खोला?
आवाज?
हाँ अब ठीक है।
देख लेता हूँ भाई, मैंने ये गलती भी कर रखी होगी तो।
हाँ
सीधा काम तो करता ही है। मैं सारे सारे वो बंद कर देता हूँ।
हाँ अब ठीक है सर आवाज।
अब ठीक है?
हाँ जी
ठीक है
वो
सर।
भी कर दिया। तो देखिए बातें वहां खत्म नहीं होती जहां आप सोचते हैं। People say acupuncture has no evidence. Now for your kind information, in 134 countries of the world, acupuncture is practiced. People say it is a pseudoscience. लोग बोलते हैं ये pseudoscience है। अब मुझसे आके बात कीजिए ना, ये pseudoscience है। लेंगोन मेडिकल सेंटर में जाके बात कीजिए, जो वर्ल्ड की नंबर 3 सेंटर है। Go and talk in Legon Medical Center that it is a quackery science. Go and talk in the Shanghai University is a quackery science. Can a quackery science exist for 5,000 years? क्या एक फेक साइंस 5,000 साल तक एग्जिस्ट कर सकता है? प्रॉब्लम इज वेयर, प्रॉब्लम इज इन योर नॉलेज। इसको यूज करना नहीं आता, समझ में नहीं आता, आप रिपोर्ट भेजते हैं और बोलते पॉइंट क्या है। फिजिकली देखिए रिपोर्ट में पेशेंट नहीं है, पेशेंट इज नॉट ऑन द रिपोर्ट्स। From the report we can identify what is the problem, but the physical condition and mental condition and his general health condition, तीन चीज का बहुत इंपॉर्टेंट रोल होता है। What are the conditions? Physical condition, general health condition and mental conditions. According to these conditions, you must use acupuncture points. Now, when you combine these three, you combine it into a syndrome. जब आप तीनों चीजों को कंबाइन करते हैं, किन चीजों को? सिंड्रोम को। सिंड्रोम कैसे बनता है? पहले बनती है उसका कारण, कारण से महाकारण, that is the cause of the disease, then it becomes a disease, then you see the symptom. Now आज मुझे बुखार क्यों हुआ है? Why do we go for blood test? We find out by the blood test which kind of fever you have, and according to that fever we treat your disease. यानी मुझे बुखार हुआ है तो मैं डॉक्टर के पास गया, उस बात को समझा कि मेरे को बुखार क्यों है। उस बात को समझने के बाद मुझे लगा मुझे इस कारण से बुखार है और उसके कारण मुझे ये तबीयत बिगड़ती जा रही है ना। अब चाहो तो ऐसा हो भी सकता है, नहीं भी हो सकता है, किंतु सही तरीका से अगर आपने चीजों को नहीं समझा तो क्या होगा? पीपल विल बिकम मोर सिक एंड पीपल विल डाई। आई हैव सीन द मिस्टेक्स ऑफ acupuncturists, I have seen the mistakes of the neurosurgeons. Often I call some neurosurgeons, what did you do? But sir, I had no other options. Were you properly trained in this type of surgeries? I shout them. If you are not trained, how has an untrained neurosurgeon did it? Are you a microvascular surgeon? If not, then please train yourself, because you're dealing with the brain. You're dealing with those arteries which are super fine arteries. You see how fine neurosurgery is done by Ipicarian. Lakshminath. Lakshminath on the other day gave a case, how beautifully they have recovered. There is no deficit. Deficit means कोई paralysis हुआ नहीं उनकी न्यूरोसर्जरी के बाद। हमने खामा बाजार में हवा फैला रखी है, ब्रेन सर्जरी के बाद पैरालिसिस हो जाता है, ये हो जाता है, वो हो जाता है, ऐसा हो जाता है। देखिए क्या है क्या नहीं है उसको सोच समझ के डिसीजन देना है। अन लोग ये सोचते हैं कि सब चीज का एक्यूपंक्चर से इलाज हो जाता है। हो तो सबका सब चीज का हो सकता है, एवरीथिंग कैन बी ट्रीटेड बाय एक्यूपंक्चर, बट आर यू कैपेबल ऑफ ट्रीटिंग इट? डू यू एनालाइज थिंग्स? डू यू एनालाइज मसल बाय मसल, nerve by nerve? There was just before you, I had 5 minutes in my hand. Medicine doctor was standing. Another doctor who was in the UNO, his son was standing. And they asked me, how by inserting a needle in the subcutaneous way, just subcutaneously, यानी इस needle को यहाँ लगाने से ये muscle power कैसे बढ़ सकता है in the last stage of Parkinson? While in the morning, this lady was unable to walk. She was unable to lift her legs. Now she is walking nicely after 2 minutes of the treatment. Can you explain me how? I asked a medicine doctor. Medicine doctor is next to me. He said, sir, only you can explain. Yes, I can explain the system. But did you study the system that I can explain it? आपने क्या न्यूरोसाइंस को पढ़ा है? आपने कौन सी साइंस पढ़ी है? पॉइंट्स। खाली पॉइंट्स पढ़ने से रिकवरी तो नहीं होता। रिकवरी आता है बीमारी का कारण को समझने से। थैंक यू। एक ग्लास और दे दो, ये दो जल्दी जरा बनो, डिहाइड्रेटेड हो गया। So acupuncture in WHO, they wanted to standardize it. Taking 3,000 points was not possible. Neither it could be classified in a syllabus, nor it could be taught. Especially teaching in America was the most difficult issue. So they went on 324 points or 354 points. And they classified 12 meridians. How many?
12 meridians.
Well, so now there are 12 meridians and 2 cabinet secretaries. Cabinet secretary means they have the power of the cabinet minister. They are not main meridians but they are submeridians, but they do miracles. Who are they? Conceptual vessel and triple warmer, right?
And governor
Am I
vessel.
correct? Huh?
Governor and conception.
Governing vessel and
Conception
triple
vessel.
warmer. Triple warmer. Am I right or wrong?
Wrong. It should be conception vessel and governor vessels.
Governing vessel and
Conception.
what is the
Run
other
and
name
two.
of triple warmer?
Sanjiao. Triple warmer is Sanjiao.
So under which meridian it comes?
It is Sanjiao.
Under which meridian it comes? Yin or yang?
Yang.
Triple
Yang
warmer.
meridian.
From head.
Yeah, right. So if you see my hand, the hand has two parts. The parts which consist here is what?
Yang.
Young.
And the part which consists here is in. So Sanjo goes here, right?
Yes.
So it's what? In meridian, yang meridian? No. It's a combination of three meridians. So it is called what? Triple warmer. So in many cases of cancer, many cases of integrative medicines, you'll find it. Right? The two channels which comes here in the chest and the back, not the bladder channel, conceptual vessel and the governing vessel, right?
Right.
Am I right?
Yes,
Yeah,
sir.
right.
So these two vessels are called the subchannels. Rest, the 6 channels are young. See, first of all, let us understand the body in TCM. What is TCM? TCM is a combination of yin and yang. Now, what is yin and yang? Yang means the higher power, yin means the lesser power. But who creates disease? The combination of weakness in any of the or imbalance of energy of the organs which are fetched by energy by these meridians creates a disease. This is the organal disease. When you read the Yellow Emperor, Suven questioned Yellow Emperor, what? कि ये डिजीज कैसे पैदा होता है? तो सुवेन ने जवाब दिया, सर, यस प्लीज कम इन, अंदर आइए. Then he said, the diseases are created by our side. Who is the creator of the disease? Ourselves. How? By our own methods, we created disease. Why all are not suffering from Parkinson's? Why all are not suffering from Alzheimer's? Why all are not suffering from osteoarthritis? Because we lived a lifestyle of such a way that the disease was created. Now, without knowing his lifestyle, understanding, entire system of medical system has become a failure. Why? Because we never try to create a lifestyle under which the modified disease, the life is modified with the disease. I have osteoarthritis. Now my walking style, the speed of walking, the bending and sitting has been modified. But yet I am not ready to modify it. मेरे घुटने में दर्द हो गया, ग्रीस कम हो गया, वो जुड़ गया, उसके बाद मैंने माना नहीं कि मेरा घुटना बदल गया है. वो ऑस्टियोआर्थराइटिस हुआ ये मैंने माना ही नहीं, मैं मानने को तैयार ही नहीं हूँ, क्योंकि 20 साल तक ये अच्छे से चला, अब कैसे खराब हो गया? This osteoarthritis was I had no pain for 20 years and suddenly how it happened? And why should I modify my life? This is something else. You continue it, you deteriorate it, and you reach to such an extent when you have a severe pain. And then you reach a doctor. When you reach a doctor, does doctor treat the osteoarthritis? No. He gives you painkiller, calcium, vitamin D3, and E vitamins and neuromethylcobalamin, vitamin B12, with pyridoxine or something like that. But can you tell me, what this is a treatment of osteoarthritis? How long painkillers can be taken? Don't painkillers have side effects? Can't you revive these patients? Once there is a stroke, you do exercise here and there, and you make it lose a lot of spastic. You see, 120 patients I've treated yesterday, and I was able to revive 120 all of them. Come to my clinic and you will see each patient has recovered by 50 to 60%. I'm taking time because I don't want to be quick. People say spinal cord injury ऐसा हो गया वैसा हो गया. I say it's okay. मत recover करो. जिंदगी भर बिस्तर पे पड़े रहो. If you have a spinal cord injury, there is no treatment in the whole world. I'm the only person who's saying, sitting here, confidently saying, I can recover. But if you say, I cannot give you time, so don't give me time. What is my problem? Who is the patient? You. Live your life in wheelchair and be happy forever. The first understanding is of what? Yin and yang. This is the basis of TCM. And this is not only the basis of TCM, the basis of life. Half part is created by male, half part is created by female. The X chromosome is given by female, male, Y or X is given by female. The combination of two creates one, and this is called your life. And that is why sex was created, not for creating population, but for giving another life, so that the world population does not extinct. But you made it a part of pleasure, and you diverted yourself, and you created a disease. Using too much sexual powers, having excessive negative thoughts, create what? Disease. You have also seen a lot of neuroproteins are created in the brain. हम बार बार नेगेटिव सोच के हम दिमाग के अंदर इतना कचरा कर देते हैं कि वो पार्किंसन बन जाता है. कैसे बन जाता है? वो एक प्रोटीन है जो सब्सटेंशिया निग्रा, यानी एक ब्रेन का एक एरिया है, इसमें जाके डिपॉजिट होने के बाद डोपामिन का न्यूरॉन्स, जो डोपामिन की कैपेसिटी होती है वो कम हो जाता है. यानी there is an area of the brain which is called substantia nigra. This area of the brain which is called substantia nigra. This substantia nigra generates dopamine. But then you did not study the entire system. 70% of the dopamine is generated in the gut. Now you did not repair the gut. Since you did not repair the gut, the disease did not recover. You did not restrict his diet. That is why in TCM, the first restriction is of diet. Now, without knowing anything, you studied acupuncture in 10 days and you became the master. After hearing 4 years also, you cannot recover patients. Why? Because clinically and combination wise, you did not work. यानी आपने ना क्लिनिकली देखा, क्लिनिकल मतलब उसके साइंस एंड सिम्टम्स क्या हैं और उसकी बीमारी क्या है. हमने एक बीमारी का नाम आपको ठोक दिया, उसके सिम्टम भी नहीं समझाए ठीक से, और अब इसका पॉइंट्स बताओ. तो इसको क्या बोलते हैं हमारे मेडिकल साइंस में? क्वैकरी. तो क्वैकरी का मतलब ये नहीं होता है कि आप किसी से पेशेंट का इलाज करो. पेशेंट का इलाज एक साइंटिफिक और सिस्टमेटिक तरीके से होता है. And that is why you have to follow that particular system. Now, for example, why we need modern medical science? We need modern medical science because it gives us direct evidence for the disease. We want evidence-based disease. तो आज अगर हम किसी भी डिजीज की बात करते हैं, मैंने आज एक्यूपंक्चर किया डीमाइलिनेटिंग न्यूरोपैथी में। पेशेंट बोल रहा है मुझे अच्छा लग रहा है, बट कागजों में भी तो अच्छा लगना होगा। We have to prove things by evidence. That is why we bought EMG and NCV machine. Tomorrow, day after tomorrow, it will be installed. Then there came a question of Siam. Can we take 6-tune needle near the epidural area? I compared the 6-tune sign with the spinal needle. मैंने 6-tune needle और spinal needle को compare किया. And then I entered with both the needles. I saw a patient who was having pain at L2, L3, L3, L4, L4, L5, L5, S1. And ये कल एक पेशेंट आया था जिसको मेजर डिस्क प्रोलेप्स था चारों एरिया में. He could not even walk. He needed urgent surgery. He said, "Sir, can you do anything to me?" I said, "Certainly, I will reduce your pain in 5 minutes." But in L2, L3, spinal needle was not working. I inserted the 6-tune needle. I went inside and I get electrical stimulation with my pain, which is called brain and muscle pain. Within 2 minutes, the pain which was radiating in quadriceps reduced. But are they still given in our medical science, TCM? See, when you are speaking TCM, it has changed now. It has changed with modern medical system. Now, you have to use this with the modern medical science. You must understand the technical jargons of the modern medical science as well as the old system, the physiotherapy system, from where you can get support and recover the patient. Forget the system that the entire money is yours. Now you have to share your money, what you want. And then your clinic will grow. Where physiotherapy is required, physiotherapy is to be given. Where acupuncture is required, acupuncture is to be given. You know, yesterday one patient came to me from US. She was given chiropractic practice there. And the best neurosurgeon of India, KVR Sastri, has written in his prescription, no neck manipulation has to be done. And she was having heavy headache, severe pain. If you write down the name of KVR Sastri, is known as the most famous surgeon of India. He's a director of Niemann's. He has taught some of the best neurosurgeons of Singapore and US. If we speak 3 best neurosurgeons of this country, one of them is KVR Sastri. Second is Adi Chako. Third is IP Cherian, Amit Goyal. These are the topmost neurosurgeons. But if we speak about the first generation neurosurgeons in topmost surgery, अगर हम फर्स्ट जनरेशन न्यूरोसर्जन की बात करते हैं तो ये सर्जन्स का नाम आता है. उसमें उसने क्या लिखा? गर्दन को यूं करना बिल्कुल मत करना. And her problem aggravated because of this. That is why in Indonesia, chiropractic was banned. Am I right? Am I right, Mickey? Mika? Anyone from Indonesia?
Yeah, you are
Yes.
right.
Is chiropractic banned in America? In Indonesia?
Yeah, in
Why it
Indonesia
is banned?
because of misguided practical.
Hmm.
One person is dead.
One person is dead. Now you understand. Let us take another example from Singapore. One acupuncturist who does not know about sensory deficit, right? You know what is sensory deficit? You don't feel any sensation in your leg. यानी एक सिंगापुर में केस हुआ जिसमें उसके पाँव का सेंसर चला उसको. उसने क्या किया? TDP lamp. You know what is TDP lamp, ma? Mineral lamp. Everyone knows it. Yes or no? Everyone knows TDP lamp? Yes or no?
Yes, sir.
Can you hear me?
Yes, sir.
Yes,
Do you
sir.
know what is TDP lamp?
Yes, sir. I have one in my chamber, sir.
Yes.
TDP
TDP
lamp.
lamp is a lamp which gives heat along with minerals. There is a physician who's a qualified physician in Singapore who had a license. He gave that heat to a patient. He did not tested it clinically. यानी एक सिंगापुरियन डॉक्टर जो क्वालिफाइड है उसने उसको क्लिनिकली टेस्ट नहीं किया. तो क्या हुआ? उसमें सेंसरी डेफिसिट है, यानी उसको गर्मी एहसास नहीं होता. So he kept on giving, he found the heat, feet was cold. So he gave TDP heat for 1 hour or 2 hours. And then there was skin burning. उसके बाद भी उसको रिकवर करते गया, वो रेफर नहीं किया. लास्टली क्या हुआ? इन्फेक्शन होने के कारण हर लेग वाज एम्पुटेड. यानी इन्फेक्शन होने के कारण वो लेग एम्पुट हुआ, यानी उसको पाँव को काट दिया गया. That leg was amputed. This is the story what we read in Facebook. And then that doctor's license was cancelled and he had to pay a heavy fine. Whatever he has earned in his whole life, he paid as a fine. So if you think learning TCM and learning about points, learning about physiotherapy is enough, I think you are in the world of 1920. Where? Where you are? In the world of 19. Where used to recover a patient by what? Proximal things. Without having logic and scientific things. But today science has changed. It has classified into parts. Yes? Anything? Just close your mic. Science has been classified into two parts. What? Evidence and treatment. Write down. What are the two important parts of science? Evidence and ट्रीटमेंट. यानी साइंस के दो पार्ट है. एक बीमारी क्या है, ये बीमारी है या नहीं है, उसकी एविडेंस यानी इन्वेस्टिगेशंस एंड ट्रीटमेंट. And third thing is clinical science of the disease. MRI has written something, but in MRI they have written clinically correlated. In every MRI they have written it clinically correlated. मतलब अगर आपके clinically आपको ये चीज नहीं मिली, उस समय कुछ और भी हो सकता है. हमारी तरफ से ये है, यानी this is what we have spoken, this is what we know, and this is what we have seen, but it may be something else also. So further investigation is this you may do to confirm. So what is the best method of understanding a disease? Every disease has signs and symptoms. Yes or no?
Yes, sir.
Yes.
हर disease का signs or symptoms होता है. Now to understand the signs and symptoms, there are clinical signs. What are they? Clinical
Sign.
Clinical sign.
signs. Signs means not SCICNCE. Clinical symptoms. Now your knowledge should be enough that out of 5, 3 must confirm that he is suffering from this disease. Otherwise, you have infinite number of investigation in allopathic medicines, infinite amount of medicines you have, infinite number of combinations you have in acupuncture points, and you will never be able to recover a patient. Just thinking, knowing about the points, you will recover it. Disease. By puncturing a point, you will recover it. It's not correct. But on the other hand, it is correct also if you are correcting the right point for the right disease. Did you understand me? Any doubts up to now? Please clarify. जो हिंदी में पूछेगा उसको हिंदी में जवाब मिलेगा, जो इंग्लिश में पूछेगा जो उसको इंग्लिश में. Those who want to learn in Hindi, they can learn in English. You can ask me your questions about the doubts you have now. I give you 10 minutes to ask me questions. Ask me questions. Do you have some questions in your mind?
What did you,
So ask.
how did you satisfy the WHO?
See, WHO satisfaction is not the changing
Asking
from
about you,
WHO is one thing I will tell you.
yes, sir.
Getting a license from a medical college is not the treatment of the patient. Knowledge of WHO is only up to a limitation. That much you must know. But with that knowledge, can you recover cervical radiculopathy, which cannot be cured by a neurosurgeon, which requires complicated neurosurgery, and I prick few needles and the problem is solved? Patient comes with severe pain, acute pain. Where is the pain?
Cervical, sir.
You imagine there is a cervical radiculopathy like this, correct? Yes or no?
Yes, sir.
Yes, sir.
यानी गर्दन की नस दबी हुई है. That means the nerve is irritated very badly, right? The patient cannot lift his hand like this also. Clear?
Yes, sir.
Yes, sir.
Am I clear or not?
Yes, sir.
Clear, sir.
Clear, sir.
Say something or I close down the class.
Yes, sir.
Clear, sir. Yes, sir.
Already I'm half sleepy, already tired, and then teaching to the walls and the teeth. These two lights. Everybody, nothing. What will I understand? No one is hearing me. I'll sleep. You also sleep. I will also sleep. Question. Make the class cheerful by asking questions.
Yes, sir.
If you don't clarify your doubts, it was an important question. WHO norms gives you a license, but it does not give you sufficient knowledge. Just a first point of your treatment. Who are you? You're a qualified acupuncturist. It qualifies you. But does it give you a knowledge to recover cervical radiculopathy, which a neurosurgeon cannot do? Can you? This is what you must understand now. You must understand what is the differences type of points you have. Which point can be used for what reason? How to combine points? How to understand the syndromes and diseases? And how to combine them with allopathic knowledge? This is why I said fellowship and review support. If you see, I feel laugh. Not even 50 students are ready to learn acupuncture. And now they are saying me this and that. I want to learn in 5 days, 7 days. I don't know what they want to learn. Out of 4 days, I'm having a seminar. I'm just saying, you can recover paralysis. Patients have recovered. 2 lakh videos are there. Even then, there is a doubt.
You are muted, sir.
Your microphone is mute, sir. Your microphone is mute, sir.
One minute.
We
No.
cannot. Yeah, now we can hear you.
Now, use acupuncture. Put points here. Here. Put take one motor line, put from temporal lobe to frontal lobe, stimulate, and what will happen? Low, acupuncture point low. LI4, TY11, LI11, 2, anterior posterior deltoid muscle में मार दो, trapezius में 3 मार दो, 2 गर्दन में मार दो. Again, you muted my mic. I'll go out of the class. Can the patient recover? क्या इस तरह से patient recover हो जाएगा? You have a stroke in the brain, a major accident. Yesterday, what did I teach? Brain accident means what? Damage inside the brain. There is a damage in the entire neural network. जो अंदर में नेटवर्क होता है, उसमें डैमेज हुआ है. सिस्टम क्लियर है. जो सिस्टम चल ही नहीं रहा, समझो आप सिस्टम का क्लर्क नहीं है, सुपरिटेंडेंट नहीं है, सीईओ नहीं है, वाइस प्रेसिडेंट नहीं है. Who will give orders? How will be the orders passed from promotion to the last part? How will my finger moves? The commands do not come from the brain.
रिकॉर्डिंग की परमिशन दे दी है मुझे.
You speak, I will
आज
not
का
speak.
जो वेबिनार है शास्त्री सर का, इसका रिकॉर्डिंग में भेज.
See, the stroke is in the brain. My hand is not functioning. What do you do as a traditional acupuncturist? You put one needle here, one needle here, one needle here, 1 year, 1 year, 1 year, 1 year, 1 year, 1 year. You get Leofen, baclofen, anti-epileptic, blood thinner, platelet thinner, right? And topic over. Is this the treatment of paralysis? Is physical exercise the treatment of paralysis?
No, sir.
No, sir.
Yeah. Neurosurgeon, neurologist can recover paralysis. How many neurologists have recovered paralysis? Let me in the world. There are 100 patients of paralysis. How many neurologists have recovered paralysis in the world? Tell me. How many
Very
neurosurgeons
few.
have recovered paralysis in the world? How many acupuncturists and physiotherapists have recovered paralysis in the world? No. What you have recovered, 30%, not even 10% you have recovered. You only gave what compensatory get paid. यानी ये मसल काम नहीं कर रहा है तो इसकी मदद से ऐसे उठा दो, यूं उठा दो. अरे what is this? Picking up your hand, lifting up your hands like this will help the patient to recover from paralysis, or you are creating a complication of paralysis. You do not know the stages of recovery of the paralysis and you want to recover paralysis. You close this first slide. First, you should interact with the paper. Let us have some interactive sessions first. Close this. Close these slides. Slides cannot teach MK Sastri. Point यहाँ मार दिया, यहाँ मार दिया, यहाँ मार दिया. एक MRI भेज दिया, sir points बताओ. You know what is the new trend in acupuncture? Sir, this is MRI of the patient. This is a video of the patient. Tell me points. First of all, this pupil should be killed with a gun. If you don't, in allopathic system, there is a system called referral. Refer the patient to the higher center. Don't we refer? Don't we have a team of doctors here? I also have a team of doctors.
नौ बज गए सर.
I also referred a doctor to the medicine doctor, and I found the CRP of the patient is 165. Immediately I said, withdraw acupuncture, let antibiotics go, and the patient gets stable. Otherwise, it will become a medical negligence case. If a person dies with infection, having autoimmune disease or motor neuron disease, do you think the patient will sustain? So first of all, having the knowledge of both the science, medical and physiotherapy and acupuncture, only can revive the patient. I don't say you become 3 in 1. I say have knowledge of it so that what part you cannot recover, take his help. What part he cannot do, let him take his help. If you think only one person can recover a patient, then hospitals were not required. In every hospital history, it has been referred to dermatologist, referred to cardiologist, clearance from the anesthetist. Before surgery, what do we write? Clearance from the cardiologist, clearance from the orthopedic, clearance from this, clearance from this. You know, in a case, they forgot to take the clearance of the anesthetist, right? And after third day after the surgery, died. The legal from where the Chief Minister, Prime Minister of India is. The point came, where is the anesthetic clearance? And the hospital had to pay 26 crore rupees. Why? Because it was his income from his the death of time to the post of retirement, and then pension time. They had to give it. यानी एक आदमी जो एनेस्थेटिक क्लियरेंस नहीं लिया, हॉस्पिटल ने कमाया हो 4 लाख रुपया, 4 करोड़, उसको चुकाने पड़े 26 करोड़. 26 billion amount was sanctioned. Even in Apollo hospital it happened. Even in Singapore it happened. His license was cancelled because he was having sensory deficit. He gave more heat. There was a skin burn. There were wounds. You don't know how to recover wounds. You use TCM rather than referring it to a Western doctor. And coming out from the clutches of the patient, he treated himself. He covered his mistake. Lastly, wounds became septic infection and he had to amputate his leg. यानी उसको पाँव काटना पड़ा एक सिंगापुरियन पेशेंट को, जिसके फिजिशियन को ये नहीं मालूम सेंसरी डेफिसिट क्या होता है. Because of his one mistake, the patient loses his leg and the physician lost his 10 years income and cancellation of his license. Now tell me, what will he do? So having the knowledge of medical science is very important. Why do we say you need to learn revision course? Because in revision course, we are going to teach you various point combination. In fellowship course, we are going to teach you about what? This. You compromise everywhere. Not, first of all, you compromise in your learning. Then you compromise in your practice. Then you compromise in the method of your practice. To teach you, I have purchased what? 2,000 American dollars, 2,000 Singaporean dollar camera. Buying a stand so that you can see me. You can see the board. I'm bringing what? Wireless speakers. Why? So the class becomes more interactive. मैं 2 लाख का कैमरा खरीदा है, इसका मार्केट वैल्यू आज के दिन में 6 लाख रुपए है. मेरी आवाज आई है आपको? Did you hear me?
Yes, sir.
Yes, sir.
Yes, sir.
Do you understand?
Yes, sir.
One mistake of a chiropractor, bend and die chiropractic practice. One mistake of an acupuncturist from Tamil Nadu. But all acupuncturists in question. Recently, Government of India has given me a questionnaire. They've asked me many questions regarding acupuncture and all. And I answered them so nicely that their minds are cleared. I said, sir, if this is quackery, then quackery is in allopathy also, sir. Patients have not recovered. Quackery is in homeopathy. Patients have not recovered, sir. Putting a patient on painkiller for his whole life, is it justified? When physiotherapy is not working, just pick some needles in a proper direction. Patient will recover. How do I recover with dry needles? How do I recover with vitamins? मैं विटामिन्स और डाई नीडल से कैसे रिकवर करता हूँ? मेरे पास 2.5 लाख वीडियो इस बात को साबित करने के लिए. आपके पास क्या है बताइए? I tell the neurologist, what do you have to prove your point? You come and examine my patient. तो इसका ये नहीं हुआ. आपने क्या किया बताइए इतने साल? 8 साल हो गए, 15 साल हो गए आपको. 15 years patient. What did you do with this patient? You're treating in the best hospital of India, Manipal Hospital, with all due regards to them. What did you do? That means every system has a limitation. Whether it's allopathy, homeopathy, Ayurveda, acupuncture. Do not try to cross your limitation, but have the knowledge of this science so that you can know whom to refer, and what to write in your referral letter. यानी आपके रेफरल लेटर में आपको क्या लिख के देना है जिससे आपके उस डॉक्टर से भी दोस्ती हो जाए, वो डॉक्टर भी आपको पेशेंट भेजे, आप भी उस डॉक्टर को पेशेंट भेजो, इससे दोनों की दोस्ती होगी. First, you have to create an environment in which we live friendly. You have created an environment of criminality. आप लोगों ने एक दुश्मनों में दुश्मनी पैदा की है. एलोपैथी वाले ने ऐसा कर दिया, होम्योपैथी वाले ने ऐसा कर दिया, एक्यूपंक्चर वाले ने ऐसा कर दिया, न्यूरो सर्जन ने पैरालाइज कर दिया. Do you know how complicated is neurosurgery? In what stage the patient has gone to the neurosurgeon? I can challenge 99% of you does not know how to see an MRI of the brain. And you're saying a neurosurgeon has destroyed the case. A physiotherapist has destroyed the case. But in physiotherapy, he was taught only exercise. What will he do? But then your duty is what? To increase your knowledge. आपका ड्यूटी क्या है? अपना knowledge को increase करो. Improve your knowledge to that extent where you can recover critical diseases like what I do now. I only recover critical diseases which are not covered by neurosurgeons and neurologists. For example, while teaching you, I had hypoglycemia. I realized my sugar low ho gaya. I realized, what did I say? Please bring me one more cup of drink. Give me something to eat. Now you see, the moment I diagnosed my disease, I'm able to revive myself in the class and I'm back to my stream. उसी तरह बीमारी के signs and symptoms होते हैं. Allopathically it is said, out of 5, 3 must be positive. यानी आपका डाउट हुआ कि ये बीमारी है, तो उस बीमारी के 5 इन्वेस्टिगेशन होने चाहिए, क्लिनिकल एंड डायग्नोस्टिक. Out of 5, 3 must be positive. आपको सर्वाइकल रेडिकुलोपैथी, कमर में गर्दन में दर्द है, how will you prove it is cervical radiculopathy? Go with compression test, stress test, sponge test, whatever test. For myelopathy, you have a doubt of myelopathy. You saw some wasting of muscles. Put your neck hand like this, bend your neck. Do you feel some sensation in your leg? Oh, it's myelopathy. Immediately write contrast MRI. Without knowing signs and symptoms of the disease, you have started treating the disease. Now what should I say? 50% of the people have written fellowship and 50% have written in what? Revision class. I realized both will not learn. Only 50 people out of my entire effort in 1 year has learned one thing, that we should learn both. Remember, you don't have 8,500 to pay. That means what? You have no interest in recovery of the patient. I only see how much interest you have. One patient gave you 5,500. But do you have the interest to recover the patient? You don't have the knowledge, interest to upgrade yourself. You don't have 1 hour to spend with knowledge. आपके पास 1 घंटा नहीं है कि आप नॉलेज को दें और आप आगे बढ़ जाएं. आप किस बात की बात कर रहे हैं? आप उस बात की बात करें जहां न्यूरोसर्जन फेलियर है, न्यूरोलॉजिस्ट फेलियर है. एक पैरालिसिस को रिकवर करने के लिए जिसने 18 साल मेडिकल साइंस को दिया है, आज वो बोलता है मैं पैरालिसिस को ठीक नहीं कर सकता. आप बोलते हैं जिसने 10 दिन एक्यूपंक्चर पढ़ा है, वो बोलता मैं पैरालिसिस ठीक कर रहा हूं. क्या ठीक कर रहे हैं आप? कौन से पैरालिसिस ठीक कर रहे हैं आप? आपको एमसीए आर्टरी का पाथवे नहीं मालूम, पीसीए का पाथवे नहीं मालूम, रॉबिन्सन्स जो नहीं मालूम. 2 सवाल आपसे पूछ लो तो आपकी भीगी बिल्ली बन जाते हो आप लोग. This are not like this. Medical science is a serious subject. उसको तरीके से करो तो it is a fun. मुझे देखो कितना मजा आता है. You give me 150 patients and every 150 patients they recover and I give only 2 minutes or 1 minute of my time. Because before going to the patient, I complete my homework. After treating you, again I'm going back to the clinic, which is downstairs. I stay in the same building. I took 1 room in the same building, right? And after all you go, I will call all these critical patients to recover again. And in recovering them, we earn lot of experience. You cannot challenge me because I have evidence today. Courts are asking me, not 1 court or 2 court. Session courts, high courts are asking me, so what is your opinion about this? And I gave a very good opinion. With a question to the judge. I'm not a lawyer, but I have questioned the judge. So tell me, under which system of medicine this patient of spondylitis can be cured? Where does the word cure exist in this medical science? Please define cure. I re-questioned and I have sent the reply in a sealed envelope. They are asking cure. You should know. First thing is what? What is a disease? What kind of disease he is having? उसको क्या बीमारी है? किस तरह की बीमारी है? ये बीमारी कैसे हुई? और ये बीमारी किस रूप में जा सकती है? 4 stages. What is the disease? What is the progression of the disease? What are the stages of the progression of the disease? And वो बीमारी किस रूप में जा सकती है? Means how will the patient die? It is called entry and exit. आप किस तरह से एंट्री करते हो उस डिजीज के अंदर और उस डिजीज से आप किस तरह से एग्जिट यानी उस पेशेंट को आप किस तरह से डिस्चार्ज करते हैं. These 4 things you must learn. Grading and staging of disease. Write down. In grade 1, what are the signs and symptoms of the disease? First of all, what is the disease? How did you define that he had this disease? First is called the definition of the disease. How did you define the person is having this disease? After clinically examining him, I found certain symptoms. Then I thought for a while, what these symptoms leads to. So symptoms leads to a disease. Write down. Symptoms speaks of a disease. Now a person came and he was saying, I'm having a very severe pain over here, but I don't have a pain over here. I said, it's okay. How much pain do you have over here? It can be anything. It can be a vascular disease, neurogenic disease, or something. Then one thing I did a compression test and I found a stress test. Oh, he's having a pain. Immediately I understood he is having unlearned nerve compression. Then what are the tests of unlearned nerve compression? I did that. And then I inserted 2 needles over here, which you have seen day before yesterday and one day before. And I stimulated with my pen. This time I make it very clear before proceeding that इस बार 2 तरह की क्लास है, सुबह की क्लास और रात की क्लास. जिसको NIBS सीखना है वो रात को पेन खरीदना है और NIBS सीखना है वो रात को अटेंड करे, और नहीं करना है कोई बात नहीं, वो ड्राई नीडल सीखे जाए, कुछ तो सीखे. जिस पैरालिसिस, जिस बीमारी को एक न्यूरो सर्जन रिकवर नहीं कर सकता, करोड़ों रुपए के इक्विपमेंट्स रिकवर नहीं कर सकते. न्यूरो सर्जरी के इक्विपमेंट्स, डिस्क रिमूवर, दिस is an investment of more than 20 to 50 crores that cannot recover a patient. यानी 50 करोड़ का इन्वेस्टमेंट करने के बाद भी पेशेंट की रिकवरी नहीं है, और आज आप पे 5,000, 7,000, 500, 700 रुपए की बात कर रहे हैं. आप क्या किस तरह की नॉलेज की बात कर रहे हैं आप? What kind of knowledge you are speaking of? 50 crore rupees investment cannot recover a patient, and you are thinking your 10,000 rupees will recover the patient without knowing anything, without doing anything, just taking random decision is a part of your life. सबसे पहली बात, अगर मेडिकल साइंस में एक्सपर्ट बनना है तो रैंडम डिसीजन लेना बंद कीजिए. Don't conclude things so fast. Google is always with you. We are always with you. If you don't understand, ask us. We'll say refer the patient, because you cannot do it. It is better to spoil a case, go to jail. जेल जाने से अच्छा 1 करोड़ रुपया का हर्जाना देने से अच्छा अब उस केस को रेफर कर दो. आप चाहिए आपको एक्यूपंक्चर का लाइसेंस हो या न्यूरो सर्जरी का लाइसेंस हो, अगर एक थोड़ा भी केस हो जाता है, एक्सीडेंटल हो या कुछ भी हो, कोर्ट में आपकी हाजिरी लगती है तो आपको सेशन कोर्ट तक ये 1 करोड़ रुपया तक का जुर्माना है. उस समय अगर आप बोलते हैं आप एलोपैथी डॉक्टर है, एक्यूपंक्चरिस्ट हैं, दिस वर्ड डज नॉट एग्जिस्ट इन कोर्ट. जज आपसे एक ही बात पूछेगा, अगर आपको नॉलेज नहीं थी तो आपने टच क्यों किया. तो बेटर है, आज हमारे पास समय है, 2 घंटा है, उसने पेशेंटों को आपकी जरूरत है. Every day there is a pile up of cases. Pile means, you understand? Every day we have hundreds of stroke cases, hundreds of accidents, hundreds of spinal cord injuries, and there are 15 years of paralysis patient, 8 years of paralysis patient. 9 साल पुराने पैरालिसिस पेशेंट के फोन आ रहे, क्या मजाक है ये? 7 साल से फिजियोथेरेपी हो रही है, क्या मजाक है ये? पूरा मेडिकल सिस्टम का मजाक बना रखा है. एक पेशेंट रिव्यू के लिए जा रहा है न्यूरो सर्जन के पास 5 साल से, वही का वही हाल है. साल 10 साल हो गए आपकी फिजियोथेरेपी को. पेशेंट में 0% रिकवरी है. उसी पेशेंट को मैंने 4 दिन में 70% रिकवर करके ट्रेडमिल में खड़ा कर दिया. कैसे? 4-5 नीडल यहाँ डाल के स्टिमुलेट करके. सबक्यूटेनियस स्टिमुलेशन, इट इज कॉल्ड सबक्यूटेनियस. आई एम नॉट टचिंग द स्कल आल्सो. This is the power of acupuncture. The world needs you. दुनिया आपको चाहती है कि आप बेहतर से बेहतर परफॉर्मेंस दें, पर आप लोग इनसे छुपते हैं। वो क्या कि आपको ये विश्वास हो चुका है, न्यूरोलॉजिस्ट को ये विश्वास हो चुका है, न्यूरोसर्जन को ये विश्वास हो चुका है, ये पेशेंट कभी ठीक नहीं होगा। न्यूरोलॉजिस्ट बोलता है इसको ये दवाई खिलाते रहो, अरे लियोफेन खिलाने से स्पास्टिटिस रिकवर होता है क्या? इस नीड्स इंटीग्रेशन ऑफ ट्रीटमेंट। लियोफेन भी देना होगा ताकि उसको स्पास्टिसिटी नहीं आए, इसको ब्रेन स्टिमुलेशन देना होगा ताकि उसमें न्यूरोप्लास्टिसिटी आए। And to prove you all, what did I do? I'm transcranial magnetic stimulation with 2 loops, which is best in the market. I'm purchasing what? Siam, which is from Siemens company. We are making one of the best recovery center of India, or best from Philippines and Asia, because I've visited all these countries. कि अभी ट्रीटमेंट दिया, 3 दिन ट्रीटमेंट देने के बाद EMG, NCV और NCS टेस्ट करके आप ये कंफर्म करो उस पेशेंट को कितना रिकवरी आया है। After doing 3 days of electroacupuncture treatment, how much recovery the patient has achieved? Where you are going the right nerve or you are going the wrong nerve? Because investigation is so costly, I purchased this equipment. I made up a setup and I all did it in 2000 rupees. I'm not from a rich family. When I came to Hyderabad, I had nothing in my hands. अगर आप ये सोचते हैं कि आप कमजोर है, ये भी गलत है। अगर आप ये सोचते हैं कि आप सही है, ये भी गलत है। Knowledge is acquired and it has to be continuously acquired. यानी एक न्यूरोसर्जन 18 साल पढ़ाई करने के बाद भी वो तरह तरह के फेलोशिप के लिए साल, 2 साल, 6 महीने, 8 महीने, 3 महीने अलग अलग जगह जाता है और वो उस चीज को सीखता है। Even a neurosurgeon today, after studying 17 years, 18 years, 19 years of his education, he goes in different places and he studies. And you people, after doing BPT, you started a treatment of the patient. Home visits. When the time of acquiring knowledge is there, you are doing home visits. The first thing what I have learned from IP Cherian, मैंने IP Cherian साहब से पहली चीज क्या सीखी मालूम है? पैसे के पीछे दौड़ना छोड़ दो शास्त्री, पैसा तुम्हारे पीछे दौड़ेगा। The first thing I've learned is don't run after money. Money will run after you. IP Cherian became the best surgeon not because of what he is doing, because he spends 6 hours with chicken beans. He means chicken beans and you do neurosurgeries with them. He continuously practices microvascular anastomosis. He's a teacher of microvascular anastomosis. His wife is A&M. What is she? A&M is a nurse, but she teaches neurosurgeons. You see her confidence. And in 2 minutes, she taught me 3 things. I respected madam and I said, madam, I want to learn vascular anastomosis. She said, without disturbing your pen, you take out the thread. यानी ये पेंट आपके पास, आपको दिखाई दे रहा है? ये पेंट है. This is a pant I have, trousers. You buy one jewelry forceps of this type. I purchased. Now, without disturbing any other threads, you take out this thread out. You must have the dissection capacity to take out the thread out from this without disturbing any other threads. That patience you should have. Because when you cut a artery, यानी अगर आप ब्रेन सर्जरी करते वक्त कोई आर्टरी को काट दिया, पूरी ब्रेन में ब्लीडिंग हो गया, उस समय आप घबरा गए तो क्या होगा? पेशेंट मर जाएगा. Patient will die. First thing you have to learn is to train your mind. Sub 5, 7 classes, 10 classes, I will not teach you with any medical knowledge. It will go with interactions. First, interact with me. If you are satisfied with me, हाँ, हम आ रहे हैं, खत्म हो रहा है क्लास. उसको बोलो जीरा, वो जलजीरा बनाएगा, जलजीरा कुक को.
आ भी रहे, क्लास भी चल रहे हैं.
कितना बज गया?
सर 9:30.
So you can ask me some questions. My patients are waiting. 9:30 is my class time.
काले पूछ लेंगे.
Yes.
हेलो.
हाँ बोलिए. सवाल
हेलो
पूछते जाइए, मैं जवाब देता जाऊंगा.
दिस इज आनंद मौर्य फ्रॉम इंडिया.
1 minute. If you ask me in English, I'll speak you in English. If you ask me in Hindi, I'll speak you in Hindi. I know only these two languages.
Hello. Good evening, sir. This is Anand Maurya from India. I want a question. What is is there a difference between the acupuncture point and dry needling? Both are the same or different?
See, acupuncture was a meridian system. It was developed by itself an independent medical system based on traditional diagnosis. Where you use tongue, pulse, and skin, and all this. You cannot say this system is unscientific. Using this system of treatment, doctors like Udipam, who are neurosurgeons, they still uses the pulse of different types of patients. When I also started doing the same thing, I take the pulse of different types of new brain surgeries, right?
Okay, sir.
And I started noting down. And then I understood, oh, this patient is going to have stroke after 24 hours. Immediately I sent him to the hospital. Immediately I saw the pulse of whom? Rajesh. And I understood he's having myocardial infarction. It is MI. Because before that, I understood this is the pulse going to be happening. The myocardial infarction is an attack. But before attack, there are symptoms of attack. These symptoms of attack sometimes are given in your pulse. So learning TCM diagnosis is different. Dry needle को एक तरीका बनाया गया है. It's a methodology which was taken in America. Why? Because to become an acupuncturist in America and to use an acupuncture license, you need to study 6 years. Then you have to give a licensed acupuncture exam and then you become an acupuncturist. While you become a dry needling expert, you don't need to follow these rules. You just prick the needle. So you are doing something without knowing anything. If you are practicing acupuncture without the knowledge of acupuncture, it is quackery. It is the same quackery which you are doing while doing physiotherapy. Without learning physiotherapy, you are doing physiotherapy. And you are asking me, I took out a middle path theory. Neither you need acupuncture nor you need anything. If you have certain knowledge of anatomy, physiology, BMS, BHMS, knowledge of muscles, neither you go in points nor you go anything. Go with the what? Holography. No need to understand the anatomy, but understand about the kinetics of the muscles. How is the person walking and how you have to improve it. Problem is not with the flaccid muscles. Problem is with the spasticity. Problem is with the residual muscles. Residual paralysis can never be recovered. Once your hands becomes like this, a crawled hand, do anything, it will never be recovered. You will die with a crawled hand. You understood what I mean?
Yes, sir, definitely.
So joining us out in America with a concept to surpass licensed acupuncturists. But what people did, there are two things which exist in this world: lust and greed. Because you want to do sex with so many people, you want to gather so many articles in your life which are of no use for you, and you want BMW, you went to an unethical practice. Learning ethical practice is 3 months' time, 4 months' time, but knowledge forever, for 35 years. You can recover patients for 36 years in an ethical way. But the way we are practicing, acupuncture is one side, allopathy is one side, homeopathy is one side. I bought all the fields in the one place. I bought physiotherapists also. I bought acupuncturists also. I bought allopaths also. I bought neurosurgeons also in the same roof. I bought homeopaths also. I integrated the system of what? Medicine. I integrated NIBS also. I integrated the system of medicine. Now there's only not one. Everyone has to recover the patient. Which is best suitable for the patient, use it. For example, I was having throat. I did not get relief. It's a question of Malaysia. Suddenly, an allopathic doctor, what is that lady doctor from Australia? What is the name of that lady doctor? Mika? I think they have gone. Rashmi, Rashmi gave me release spray from Best Flower Remedy. She gave me 2, 1 drop of my ear, right? I got immediate relief. And I realized, oh, Best Flower Remedy recovers this. I don't know about it. I started and I understood. And when I did, I got results. It depends on you how you want the results. You think 1 month is enough to recover the patient? Try 100 years, you will never recover. Your punishment is what? Your frustration is your punishment. The frustration of the patient, frustration of the attendant, the death of the attendant, frustration before the death of the attendant, and first punishment is the lack of confidence and biggest frustration of the physiotherapist. I have seen, after 35, 40 years, physiotherapists have become more frustrated. Neurologists at the age of 40 years, the hair becomes white as 65 years old man. So what is your age? 65. Your hairs? Say, it looks like a 75-year-old man. 75 साल का आदमी का जैसा चूल दिखता है आप लोगों का, एक न्यूरोसर्जन का। मतलब सर क्या हाल है हो रखा आपका? मैं आपको एक फोटो दिखाता हूँ डॉक्टर महेंद्र बाफना की। आज से 25 साल पहले मैं उससे पहली बार मिला, जीवन में 2 बार मिला, आज से 30 साल पहले और अब 1 साल पहले। इतना यंग, हैंडसम, माइंड ब्लोइंग यार साला। कोई लड़का या लड़की देख ले, लाइन मार ले उसको। Whoever sees him, लड़का भी देख ले तो लाइन मार ले, लड़की भी देख ले तो लाइन मार ले, इतना हैंडसम। And when I saw him after 25 years, he was looking like my grandfather. I was looking like his son. Someone asked me, is he your grandfather?
सर
हाँ,
9:45 बज गए सर।
तो बंद कर दो क्लास।
हाँ, 160 लोग थे, 116 हो गए।
तो होने दो, हमें क्या फर्क पड़ता है?
नहीं, फिर देख लो सर। फिर अब
देखिए, एक बात मैं बताता हूँ प्रकाश जी।
हाँ।
हजारों आदमी मेडिकल साइंस पास करते हैं पूरे
नहीं,
इंडिया में। 50, एक बात सुनिए, 50,000 आदमी मेडिकल साइंस पास करते हैं। स्पेशलिस्ट कितने बनते हैं?
अरे सर वो ठीक बात है, बिल्कुल ठीक है आप अपनी जगह।
हमें स्पेशलिस्ट चाहिए।
आपने
इसको
जो
नहीं सुनना है, मत सुने।
अपने टाइम दिया था ना, वो टाइम
अब
आप
वो
2
ठीक
घंटे
है,
का
चलो
टाइम
10
कर
मिनट
दो,
एक्स्ट्रा लग गया तो क्या फर्क पड़ गया?
8 से 10 कर दो, 8 से 12 करा दो, फिर सब अपनी
कोई
अपनी।
बात नहीं, क्लास तो हम लोग एक लेक्चर लेते हैं मेडिकल कॉलेज में, 10-15 मिनट एक्स्ट्रा लग गया तो क्या फर्क पड़ गया? बात तो पूरी खत्म होने दो।
ओके ओके।
बात ये है कि कार्डियोलॉजिस्ट भी सक्सेसफुल नहीं है। He can put stent, but he cannot recover the patient. Neurosurgeon can do operate, but he cannot recover the patient. Physiotherapy can do exercise, but he cannot recover the patient. But if we integrate our knowledge with acupuncture, with physiotherapy, with things, allopathy medicines, which are continuing, let it continue. With that, if you integrate certain system of medicines, people get instant recovery. What do you want? Immediate recovery? Yes, I want recovery on the table. आप लोग क्यों बोलते हैं? आप 10 मिनट की चिंता करते हैं, मैं नहीं चिंता करता। मुझे तो अभी रात के 2 बजे तक काम करना है। मैं सोऊंगा सुबह 4 बजे, तो मैं ये क्या 10 मिनट काट दूं? मुझे कोई फर्क नहीं पड़ता क्लास में 1 स्टूडेंट हो या 10 स्टूडेंट हो, रिकॉर्डिंग उठा के दे दो। जिसको सुनना सुने, नहीं सुनना नहीं सुने।
So who wants to learn to stay or not want to learn can quit.
Yes.
That's the funda only.
Yes. Those who want to learn, they should learn. Those who want to quit, they can quit. But एक बात ध्यान से रखो, कभी 9:15 भी बच सकते हैं, कभी 9:30 भी बच सकते हैं। We are physicians. We take out 1.5 hours somehow from our time. Why? Because patients are waiting and we have to work up to 3 o'clock in the morning. We are giving our precious time free of cost to you so that you become expert. But before you become an expert, you must understand one thing. Knowledge is precious. Vidya vinati vinayat vinayat dadadi patratam dhanatapitam dhanata dharmo tato sukham. Yani knowledge brings skill. First bring skill in your hands. Skill brings wisdom. Wisdom brings money. And money which you spends with wisdom only will bring you happiness. You want to become an expert or you don't want to be an expert? Decide yourself. सही बनना है या गलत बनना है, डिसाइड कर लो। एक्सपर्ट बनना है या अनएक्सपर्ट बनना है? पैसे के पीछे भागना है, भागते रहो। 1 रुपया भी हाथ में नहीं आने वाला। I have seen neurosurgeons. I am a head of the department of a medical college. कुछ नहीं आता पैसा हाथ में। और अगर सही ढंग से प्रैक्टिस करोगे, सही नॉलेज से प्रैक्टिस करोगे, सही तरीके से प्रैक्टिस करोगे, थोड़ा सा ज्ञान हासिल कर लो, थोड़ा सा समय अपने आप को दो, 1-1.5 घंटा 2 घंटा दिन में अपने लिए निकालो और 4 महीने बाद देखो चमत्कार। 5 मिनट में, कल की बात हो रही थी, yesterday's question, Mr. Rawat recovered one patient more than Adosin. A patient was used to prescribe Adosin for painkiller, and Mr. Rawat stimulated his pain 10 seconds over this, and the pain of the knee is gone. What you want? वो आज आपको डिसाइड करना होगा। पहले वो डिसीजन लो, फिर ये डिसीजन लो कि आपको रिवीजन कोर्स करना है, एक्यूपंक्चर कोर्स करना है, आपको क्या करना है। पहले अपना गोल बनाओ, जीवन में आपको क्या बनना है, व्हाट यू वांट टू बी इन योर लाइफ। आपको अपने अंदर के गुण को पहचानो, आप क्या हो और उस गुण को कैसे निखरते हैं। व्हाट यू वांट टू बी, you want to be an expert or you want to quit? Better quit. We are happy though with those people who have quit their game. We are recording the classes. Let them hear the recording classes. Because in Singapore it is 12:30. They are feeling sleepy. Let them feel sleep. It is not Indian class. It is an international class. I'm sorry if I've hurted any of you. Any more questions? Any more questions? See, only remember one thing, what you want to be. A person who recovers a patient on the table, or a person who takes 10 years to recover a patient. एक आदमी जो 10 साल लेता है पेशेंट को रिकवर करने के लिए, एक आदमी जो 15 मिनट लेता है पेशेंट को रिकवर करने के लिए. आपको क्या बनना है? एक तबला मास्टर बनने के लिए घंटों का रियाज, लता मंगेशकर बनने के लिए घंटों का रियाज करना पड़ता है. You have only one Lata Mangeshkar. You have only one Amjad Ali Khan. But to become that person, you must have what? Years of practice and a good knowledge. What you want to be. Decide yourselves. Thank you so much.
Thank you very much, sir.
Thank you very much, sir.
Thank you very much, sir. Thank you very much.
Very much, sir.
Thank you, sir.
Thank you, sir. Good night.
Good night, everybody.
Thank you, sir.
Good night, everyone.
Thank you.
Thank you, sir.
Good night, sir.
Papu, thank you, Alidaya.
Excellent class, sir. Excellent class, sir.
Bye, everyone. I'm shutting down.
Good night, Whitney.
Thank you, Whitney.